The title of this webinar is, as you see on the screen, Interventions for both acute and chronic musculoskeletal inflammatory disorders. I am Dr. Don Hayes, DC. I'm the president of Greens First, and I'm also the developer of the Inflame protocol. Also, as Spencer said, we're really delighted to have as a guest speaker today, Greg Comerford. Greg is the Vice President of Science for Nature's Crop International. The ones that manufacture our Greens First Omega-6 ahi flour. When we get to that section where we talk about products, Greg's going to enlighten us on existing human clinical trials, on the metabolic effects of healthy omega-6s. There's things that we just don't seem to understand as much as we should about sixes. And his message primarily is going to help focus on when our patients get too much arachidonic acid dumped into their blood after they incur a musculoskeletal injury, some type of a tear of the tissue, and it gets dumped into that, why that makes it so hard for us as clinicians to be able to resolve those inflammatory disorders. So we'll look forward to that. Now, today I'm going to discuss published research from the Center for Experimental Therapeutics at Harvard Medical School, who for the last 25 years have had as their mission to identify clinical ways to measure and resolve both acute and chronic inflammation. Now, the director of that center is Dr. Charles Sirhan, who had the actual lab named in his honor after his famous discovery in the year 2000. You see, Sirhan discovered a hormone that no one had ever seen before that appears in the blood instantaneously only after the body receives some type of an inflammatory insult. It can come from either a trauma, a whiplash, or a pathogen. He named that hormone, because he discovered it, a resolvin, because he noticed that they help resolve inflammation. And he also notes that resolvins are made on demand, as I said, from the body's supply of omega-3s, both EPA and DHA, if, and this is a big if the patient is not deficient. Now, these resolvins are needed. They're very necessary in order to turn off any inflammatory response within the allotted time, which is typically 24 hours, so that the body can then begin to resolve the musculoskeletal pain and inflammation issue. Now, the entire medical and pharmaceutical world became very excited and went on a scientific quest after Sirhan's discovery to capitalize on this information. Unfortunately, most of the alternative medical world are even today still unaware of the discovery, and we're talking 20 years later. But in 2017, fairly recently, Sirhan built on that discovery and published what I feel is the most famous study to date of his, and that's this one: treating inflammation and infection in the 21st century. Basically, Sirhan, that research in 2017, it provides us as clinicians an actual roadmap, a roadmap that we can follow today if we want to evaluate and treat musculoskeletal pain and inflammation. And Sirhan said in his conclusion of that research that it's time for healthcare practitioners to challenge current inflammation treatment protocols and then develop new avenues, that have better potential outcomes. Now, I can tell you one group of clinicians that are taking advantage of Sirhan's research, and that's the orthopedic surgeons. It seems like they're the only ones that are. Most orthopedists today in their practices, they have a conservative back pain protocol that incorporates both omega-3 blood testing and therapeutic doses of a prescription omega-3. And physicians, as you probably know, typically won't recommend, supplements. They prefer instead to prescribe a pharmaceutical omega-3, which really, in their case, it's nothing more than a very potent, very high yield EPA DHA supplement. And boy, are they recommending it. The leading omega-3 pharmaceutical product that is utilized for Sirhan's research is selling in excess of $1 billion a year. Unfortunately, most of us alternative practitioners, we don't even know of Sirhan's research. I mean, some heard the name, maybe those of you listening have, maybe some of you haven't even heard of his name, but we know that omegas are anti-inflammatory. So, you know, many of us will carry our favorite brand and we'll sell a few bottles, but that approach won't deliver Sirhan's clinical outcome. You see, Sirhan's research is very clear. If you want to effectively treat musculoskeletal inflammation and pain, you have to evaluate the blood for an essential fatty acid imbalance. And then based on the results you get from that blood test, then you know how to appropriately dose the omega-3s to turn off the inflammatory response. So what I'm going to suggest to each of you listening is an actual new way, if you will, that we can improve clinical outcomes for musculoskeletal pain and inflammation. And it'll incorporate Sirhan's research. I mean, basically, Sirhan discovered that an essential fatty acid imbalance, a deficiency that leads to an imbalance, can lead to musculoskeletal pain and inflammation. He also discovered that full spectrum omegas and polyphenols can reduce the inflammation. It can resolve the inflammatory response in a timely manner. It can help repair the tissue that was damaged from the inflammation. And get this, it can all be objectively verified, using a fingerstick blood test. Now, while I'm speaking of that blood test picture there in the top right-hand corner, if you're a licensed active practitioner and you haven't received a free inflame test kit yet for yourself and scheduled for a courtesy 30-minute consultation on your results, to find out if you, in fact, have an essential fatty acid imbalance, be sure and call Spencer at Meyer DC. The toll-free number's on the screen. It's 800-472-4221. His extension is 5057, and have him send one out to you and get yourself tested right away. Now back to Sirhan's research about treating inflammation and infection. You see, his research convinced orthopedists that a large percentage of a patient's musculoskeletal pain and inflammation can be due to an essential fatty acid imbalance. Now, if a patient has a EFA imbalance, then has a musculoskeletal injury on top of it, what happens is inflammatory omega-6 arachidonic acid, those are the bad guys, if you will. Those are the inflammatory cytokines. They're going to get released into the blood due to the tearing and injury damage, making the condition worse. Now, if practitioners such as myself, as a chiropractor, if I only conduct physical exams, such as, my typical range of motion or my motion palpation, and I don't test the blood, I'm going to end up missing any underlying EFA imbalance, and that can lead to a reduced outcome. I mean, Sirhan's recommendation is that you do both physical exams and blood testing on all musculoskeletal cases, because why? An essential fatty acid imbalance can only be determined by testing the blood. So the question is, why does the essential fatty acid imbalance cause musculoskeletal pain and inflammation? The essential fatty acids, they have to remain in our bloodstream and in our blood system within a very narrow clinical blood range. In order to do this, they have to be there to help maintain what Harvard calls and what research now understands as cell membrane fluidity and prevent inflammation. You see that cell membrane in that picture there, that's all we are, is trillions and trillions of cells, whether it's a brain or the heart or a muscle that we just whiplashed. All cells have a membrane, a bilipid layer, and things have to get through that membrane if that body's going to live. Water has to get through the membrane. Most of our patients are intracellularly dehydrated. That causes a lot of fatigue. But nutrients, you're giving them vitamins. They're not getting through. If a cell membrane has lipid packing, it has an abnormal cell membrane ratio, and it has a deficiency, then it becomes lipid packed and things can get in. And more importantly, or maybe just as importantly, the waste products inside a cell can't get out. This contributes to what they call cell membrane inflammation. So the inflamed blood test, when you do that with your patient, it will determine if essential fatty acids are in that normal range. And if they're not, it will provide you the objective proof that you need to help bring them back into range. I mean, basically, the inflame will help bring your musculoskeletal practice into the 21st century. Now, you see, inflame works because it's based on the blood. And we all know that blood is the gold standard of diagnostic testing. The NIH says that 50% of a patient's medical file is blood testing, and physicians use those blood tests to make 70% of their treatment recommendations. Now, most alternative practitioners, especially chiropractors, I mean, we don't do blood testing, and many patients really wonder why. Inflame is a blood test that practitioners can legally use. Why? Because patients take the test home, conduct it on themselves, right? Send the data to the lab and ask the lab to email you the results. I mean, there hasn't really been a blood test that could be used and justified for every musculoskeletal patient until now. I mean, if the patient has acute, chronic, or both, we would probably be wise to test their blood. Now, know this, inflame is not intended to determine if a patient's sick or well. It's instead wanted to be used to help correlate the essential fatty acid imbalance or probability of that with both acute and or chronic inflammation. The first test in there will help to correlate with acute, and the second one will correlate with chronic, and I'll go over that in a little more detail when I show you an example. But before I show you the examples of some of these inflamed tests on actual patients, I want to review the other part of Sirhan's research on treating inflammation, of both musculoskeletal and infection in the 21st century. And let's talk about the concept of infection. You see, in school, we were taught that if a patient has an elevated white blood cell count, we need to think of inflammation being caused by an infection. I mean, a normal white blood cell count is somewhere between 4,500 and 11,000. But if a patient had a value double that, let's say you found out a patient had double the 11,000 high norm of 22,000. I mean, obviously, we'd be very concerned. We'd say, hey, they must have an infection. Well, what if it's much higher than that? What if it was 10 to 20 times higher, say 100,000 to 200,000? What now? A serious thing that we would take very seriously. Well, it's the same thing for any blood test. I mean, if blood values fall outside established norms, we have to consider that as serious. I mean, it's no different for a blood test that measures essential fatty acid imbalance. I mean, after all, essential fatty acids are called essential for a reason. The body can't make those essential omega-3s. It can't make those essential omega-6s, but they're essential for the body to stay alive. So if a patient has an essential fatty acid imbalance, and it's outside the normal blood range, we have no choice. We need to help that patient bring them back into the normal range as soon as possible. So let's take a look at Sirhan's research diagram. This is the one that he published alongside his treating inflammation and infection in the 21st century. It's on the screen now. Up in the top left-hand corner, you see what he puts there. He says, here's how the immune system gets alerted. One or two things. There's either a barrier break, you get poked with a knife that has pathogens on it and they enter the body, or as you see there is some type of a traumatic injury, trauma. Hey, that relates to us. The patient has what? A whiplash, sprains their knee, lifts a heavy load, tears their low back. Either one of those do what's in the second circle there, the vascular response, as you can see there. Both of them alert the immune system. Now, what the immune system is going to do is fire up the inflammatory response. That's a normal, healthy thing to do. And then it goes looking in its reserves in the cell membranes for a sufficient amount of EPA and DHA, the omega-3, in order to make the resolvin hormone that Sirhan discovered. And where's that on the diagram? Right there. You see the omega-3s, that if they're there in sufficient amount, the next circle over, it makes the resolvins. If they're not there, it can't. But that's what the immune system starts to do. Now, if they have sufficient amount, and the only way you're going to know that is you test a drop of blood. You and I can't guess that. We're not going to get that from a range of motion study. We can't do it by their symptomatology. Some hurt bad, some don't hurt as bad. But we have to be able to see the drop of blood. If they have sufficient quantity, and I'll tell you what that has to be, then guess what happens? It goes over to homeostasis. In other words, it starts the process of turning off the inflammatory response within that 24-hour window, and then starts the healing process. We need this chiropractors as an assistant to help us be able to help the patient get well sooner. We now have the research. That's what he means to the orthopedic surgeon, find out if they can actually make the things that can resolve this. And let's say they can't. Let's say they're deficient, I'll show you that, or they have an imbalance, and this doesn't happen. If that doesn't happen, what's the alternative? Well, he shows it that on the chart as well. You see in that first circle, the resolvins are not going to get made. They can't get made if you're below a certain percentage. When they don't get made, guess what? That acute injury immediately turns to chronic, and then down the road, as it stays there, it leads to organ fibrosis and degradation, and eventually they're anticipating possibility of a chronic disease to a certain organ. Now, this has also been published, his research, in the #1 medical pathology textbook, Pathologic Basis of the Disease by Robinson Cotran. Look at the top, the same kind of thing. If in the top left injury, that circle, if the soft tissue is sprained and damaged, if there's sufficient resolvins there, as depicted with the little blue dots, it will go to resolution. You see how clean that injury looks like to the right in the right circle? You see that in my opinion is what we think we're doing chiropractically every time we adjust a patient. We are definitely reducing the stress. We are definitely beating back inflammation, and we are helping, no matter if it's the adjustment and some therapies and lasers or whatever. But it's all dependent on the immune system and your supply of EPA, DHA in order to make that resolvent. You don't have it, then they show what happens in lieu of that, and that is scar tissue. And it ends up being fibrosis, and that is long-term and a problem. So basically, an essential fatty acid imbalance can only be confirmed with a blood test. You can't guess on this. It's just simple. I mean, if a patient has an omega-3 deficiency, or they will have, you can count on the fact that they have a deficiency. If their index is below, and here's the number that Sirhan and his research determined, 8%. If they're below 8%, they have a deficiency, they're not going to make resolvents. It's that simple. And if they have an essential fatty acid imbalance, and you can say for sure they do, if the ratio is greater than 3 to 1, that's 3 arachidonic acids to 1 EPA. Let's take a look at a couple actual patient reports. Now, this is a 62-year-old male, says that he gets occasional low back pain, mostly after he works out really hard. If he stresses himself in the gym, works out too hard, he gets this issue, but it's cleared away with chiropractic adjustments and maybe ice packs. So, you know, he's very happy. The chiropractic care works, but he's a patient with that kind of symptomatology. Let's take a look at his blood test. It's omega-3 index. Now, first look at that on the right so you realize how intuitive this looks. When you print this out in color and give it to a patient, it becomes a tremendous referral tool that the patient will share with their spouse, their coworkers, their neighbors, their friends. I mean, it's unbelievable. And it's not like any lab test you've ever seen, but I want you to make sure that you're comfortable. It is from the #1 CLIA certified lab in the world, the one that pioneered this test a few years after Sirhan discovered the resolvent. So it is extremely accurate. So this is the omega-3 index. So the first thing you look on there is find this patient's index. Look how easy it is to find. It says your index in that big blue circle right there. And what is the index number? It's 13.82%. Now, what does that mean? What does that mean to you as a chiropractor? What it means to me, and I want you to understand, and what it means in the science of what Sirhan discovered, is that that's all the cell membranes in that patient's body collectively. I don't care if it's the brain and you're concerned about Alzheimer's, or it's the neck and you're concerned about this whiplash, or it's the heart, you're concerned about cardiovascular issues. All cell membranes collectively in this patient has 13.82% of the content of the membrane is EPA and DHA. It measures EPA and DHA. They have 13.82%. Now, what's normal? Well, I told you earlier briefly, it's 8%. Sirhan established that is normal. That is a line in the sand. That is the bare bones normal. If you have 7.99%, if you go below 8%, you're not going to be able to make resolvent hormones. Now, 8 to 12, the higher, the better. And we would prefer higher. So where is this patient? 13.82%. Wow. Wow. Is this person able to make resolvents? Of course they are. Well over that, aren't they? So this allows you as a clinician to say, I'm going to have an assist here. I'm going to have the immune system helping me to turn off the inflammatory response and rebuild the tissue while I adjust them, while I use therapy, maybe even while I recommend some other vitamins that I know they need, because I got the assist. Now look at that color bar up there from red to green. I want you to see how intuitive that is. See where they are? He's way over in the green. That's a pretty good thing for a layperson to see. There's also this, the stats of the normal are on the chart. There's research here. The red on the left is telling you what to look up if you are under 8%. On the right, what to look up if you're over 8%. And down here is the detailed information about the nutritional supplements if they need them. Now let's go to this patient's second test, the omega-6 omega-3 ratio. What does that mean? It means the first number, the 6, is the inflammatory arachidonic acid, the bad cytokines, if you will, the ones that make and cause inflammation. You got to have healthy omega-6s. It can't be none, but you got to watch how many are there. We need to see the ratio to the 3, which is the anti-inflammatory omega-3s. Let's look at this patient's test, keeping in mind his symptomatology. Okay, so this is the ratio. Again, very intuitive, very colorful. What is the ratio, the 6 to 3 ratio on this? It's easy to find. It says your ratio, it's in the circle. The ratio on this patient, 2 to 1. What does that mean? He has 2 bad arachidonic acid, inflammatory cytokines for every 1 good omega-3. Is that good or bad? Well, normal from the lab is 3 to 1. Normal is not optimal. Optimal would be 1 to 1. It's said by the scientists that they think the original person on the planet probably had a 6 to 3 ratio of 1 to 1. So 3 to 1 is their maximum. If you go above 3 to 1, if you have more than 3 bad arachidonic acids every 1 on that cell membrane, you have an essential fatty acid imbalance. How's this gentleman? Well, this patient's sitting at 2 to 1. What does that tell you as a clinician? Is they're likely to have lipid packing? Is the cell membrane going to be clogged? Or is water able to get through? Are nutrients able to get through? Are waste products able to get out? Yes, they are. He will respond. He will, quote unquote, hold an adjustment well. Whatever you want to say. He's going to respond to the mechanical care so much better because of where his essential fatty acid. This is what the orthopedic surgeons are using to make the determination what they need to do from a prescription point of view for the omega-3s. So let's look at his bloodline. You see there, he's way over in the green. There's the normals again, and there's the research there. And down below on this one is the blank areas where you can actually write on this patient's blood test the amount of products you want them to take daily. Let's contrast this with another patient, a 51-year-old female, 11 years younger, because age has nothing to do with this. But look what her complaint is. Constant, right, chronic, low back and hip pain. Get this, chiropractic adjustments and laser therapy don't seem to help her. This is the type of patient that says, oh, I tried chiropractic. I tried Hayes chiropractic. Chiropractic didn't work. It's not helping me. So chiropractic must not help. The patients that we are able to help get them symptomatically better quickly, and they feel all right for a while, the problem comes back. They don't, quote unquote, again, hold the adjustment. Now, let's take a look at her blood test. Wow, let's find her index. What's her index? You're kidding. 2.80%. Remember what normal is? 8. If you're below 8, you don't make resolvents, right? We'd rather have it 8 to 12, the higher the better. What's the likelihood that this patient is making resolvents? It's unlikely. There are no assists there to help you with your therapy. You need to be able to help this patient, and it's not about giving them all kinds of vitamins. In fact, vitamins are not what she needs. She needs that cell membrane change. She needs that oil change, if you will. Take a look at her red line. She's way over in the red. See her index? Again, that's not a place to be. Now let's take a quick look at her omega-6 to omega-3 ratio. What is her ratio? Wow, 12.4 to 1. Remember, normal, 3 to 1. Optimal, 1 to 1. What's the likelihood that she has a lipid packing? What's the likelihood that water and nutrients can't get through her cell membranes? Yeah, omega-6 is a arachidonic acid made with single bonds. They block things. Double bonds are the omega-3s. Things aren't getting through. Look where her red line is, way over there. So when we put them side by side and compare them, it's pretty easy, isn't it? You got a patient on the left that has an index as high as you can see there, certainly well above normal, 8 to 12%, the higher the better. And you have one over here at this. This is such a tool for you. Once you do this on 10 or 12 patients, you're not going to be able to practice without it. It gives you a guideline. Just like Suran says, it's time for us to make a change and have the blood test tell us exactly what else we can add to the patient. Now, make no mistake, I'm a chiropractor. You still have to deliver your chiropractic care. It's getting the adjustment to hold, getting the therapy to work, be more effective, and treating the right reasons. Now, look at when you compare the two ratios. I mean, when you see the ratio of 2 to 1, way in the green, and she's that over there, you're kidding yourself if you think all she needs is vitamins or all she needs is an adjustment. She has to have a biochemical change on top of the treatment. So really, we know how to test them now. It's a simple drop of blood. You buy this thing very inexpensively, $40, and most doctors will sell it for 80 to 100. You know, you make 100% markup. It's the drop of blood that you need in order to correct, first of all, to find out if they have that, and then to correct it if they do. And here's how you're going to correct it. You see, it's very simple. We just said patients that have an essential fatty acid imbalance will have a ratio greater than 3 to 1. It's that simple. So what do you have to do? You have to drive more omega-3s into that cell membrane. And then and those omega-3s then will edge out or replace those excessive omega-6s. It's not going to happen easily or overnight, but that's what has to happen. And this will increase that cell membrane fluidity. Now, fortunately, there was research because of Sirhan published in 2010 that tells you and I how long it takes to drive EPA and DHA into those cell membranes, into the human cell membrane, and dilute out the 6s. Research on, human clinical research on people. And look what it's entitled, How Long to Drive Fatty Acid Composition in Human Cell Membranes with Omega-3s. And the patients were supplemented with a very high yield, ultra pure omega-3 fish oil capsule. They were using, get this now, a predetermined therapeutic dose, not label claim. They was determined by the blood what they needed. They were given that, right? And then they had their cell membranes retested 4 times, baseline, 4 weeks, 8 weeks, 12 weeks. And they had their essential fatty acid balance also determined very sophisticatedly, right? Get this, now at each 4-week lab test, both EPA and DHA increased within the cell membranes of all the patients, every one of them, while at the same time, the omega-6 arachidonic acid cytokines decreased. So what did that lead the researchers to report? You and I could get a healthy essential fatty acid balance back within 12 weeks. Now take a look at this page 3, figure 1 from the research. You see, The graph of the bottom line is the time over weeks, 12 weeks. Up is going the level of the EPA DHA. So at baseline at 0, and by the way, you see the square box is EPA in the study, and the triangle at the top is DHA. So at baseline, you see where they're at. 4 weeks in, look at the huge jump by giving the patient the therapeutic dose of EPA and DHA, not just label claim off a bottle. That increase there is significant. And I want you to realize it doesn't take 12 weeks for the patient to feel better when you put them on this program. They will start to feel better immediately because they're going to improve the cell membrane fluidity. They're going to get more water in and nutrients in, and inflammation is going to go down. But it continues at 4 weeks, 8 weeks, and hits a baseline at 12 weeks. So the additional conclusions were this, that human cell membranes, they can be increased by increasing the intake of high yield, full spectrum omega-3s. Second, they came up with the results occurred because they used a therapeutic dose, not just a label claim dose of omega-3s over time with a maximum at 12 weeks. And finally, the EPA DHA increase at the expense of the inflammatory omega-6s. Incredible research that did it, and the proof is right there visually on how long it takes us to help patients. So how are we going to implement inflame in practice? Well, it's pretty straightforward. Let's take the 2 patients. This one here has minimal symptoms, adjustments hold, gets adjusted when he feels he needs it, and he has a high dosage of content of EPA DHA. You take the 2 tests, you see them on the right where the blue circles are, and it's pointing over to what I call, excuse me, the inflame dosage chart. That dosage chart is something we will provide you as a practitioner when you buy your first set of lab tests. And as a disclaimer is you make the decision what the patient needs, but these are guidelines to help you. This is not for a patient. This is for a practitioner to get some idea what to do. So you take the data, you go to the dosage chart, and you make the decision exactly what they need. Then you use that dosage chart and you enter the data on the patient's file. Now, in this particular patient, maybe because they're so well, they don't need anything in line of essential fatty acids. But you have to know essential means they got to be replaced every day. So either you have a decision to let them do what they've been doing a pretty good job, or you can recommend what we'll call a maintenance dose. And Sirhan does say there is a maintenance dose of EPA DHA that you should be using every day if you're already well. And that's on this dosage chart. So you make that call, what you want to do. But when we go to this patient, same thing. We take her 2 tests. We know how out of range they are. We find out where she's rated on there. And when we find that out, we see the recommendation for the dosage of the products there. We take them down and recommend them and offer them to the patient. And then we just wait the time frame to make sure that it does and retest them. So if we look at the products that are needed, let's look at our first one happens to be our flagship product at Greens First, the polyphenol extract powder. Now, what Harvard talks about polyphenols, what they're talking about, polyphenols are what gives fruit and vegetable their color. So in other words, if you have a really dark green broccoli, there's more polyphenols in dark green broccoli than light broccoli, right? But you can't eat enough with just the dark green. So what we've done, and they're so important, what we've done is we've taken 54 different superfoods, extracted the polyphenols and condensed them and made them much stronger. And so in that powdered product, a scoop of that's a month's supply, that in water will then reconstitute these polyphenols that you drink. Polyphenols have been shown to alkalize the outside of the cell membrane. Now we all know about pH imbalance. We won't go into it, 0 to 14. 7, above 7 is considered alkaline. The cell membrane needs to be alkaline in order for the EPA, DHA, SDA, the various 3s and 6s to get through the membrane and into the membrane itself. So when you do this polyphenol extract powder with the therapeutic dose, you're more likely to get it in. So it's a very, very critical product that you need to use. Now, when we go to our Greens First Pro Omega-3 850, hey, listen, this is really very important. You have to have a very potent, high quality omega-3. Now, any company that has a good quality omega-3 gets them from the same source. You know, pelagic fish means small little fish from the cold, pristine waters of Norway. Then you take that fish, the little ones, so hopefully there's not too much toxin in them. You don't use the big fish, and then you purify it. You got to get rid of the mercury and the heavy metals and the pollutants. You must get that out. And this process, doing that, like we do it, will help then to concentrate the EPA DHA. What you see in that capsule there, and when you say omega-3 850s, that capsule contains the active ingredient, 850 milligrams in each capsule. It's vital that we have it. And we're proud to tell you that the Omega-3 Pro 850, right, our product, is 10 milligrams more concentrated and more potent than the leading medical therapeutic product. So, but it happens to be 8 times less expensive. Now, the inflame protocol, we know that. You just got to drive more EPA DHA into the membrane. It'll help dilute down the bad guy, right? It requires a very clean, refined product like we have there. And what we have to do is make sure that there is a sufficient amount of EPA DHA inside that membrane. You have to be above 85% to have purity and remove the toxins. And Greens First is 88.8%. So we make sure that we give you the cleanest product possible so we can get it in the membrane. Now, in addition, it exceeds every rigid standard that the leading pharmaceutical product does, except 2. Number 1, we're 10 milligrams more potent. We're 850 per capsule, they're 840. And get this, it's 8 times less expensive. That product sells 120 capsules for roughly around $41.99 retail. You make about $18 a bottle. You know what 120 of the leading pharmaceutical drugs sells for? Close to $320 a bottle. And it's being used quite a lot at $1 billion a year in sales. The problem is clinicians that prescribe omega-3s based on a bottle claim or that one size fits all, right? That approach, they don't use a blood test to know what they need therapeutically. They don't follow Sirhan's research. Good chance if they have an essential fatty acid deficiency and an imbalance, we're not going to get the major outcome. Okay, that switches us over to the final product, which is the omega-6 ahi flower oil. As I said to start with, a patient can be, and this is what Greg will help us understand, they can be omega-6 dominant at the same time be omega-6 deficient. Look up there at that ratio. When you see 12.4 to 1, no question, this patient is omega-6 dominant, but she's also omega-6 deficient. So Greg is going to, he's the vice president again of science at Nature's Crop International. And Greg, I know you're listening, so I'm going to turn this over to you to take over. And then when you're done, Greg, switch them back to me. And doctors, please hang on because I've got a couple of little other items to say as we wrap it up to show you exactly how to use this in your practice. So what I'm going to do is I'm going to stop sharing screen right now.
Okay, I think this should work. Let me try again. And can you see the ahi flower screen, everyone?
Yeah,
we can see it.
Okay, excellent. Well, thanks everyone, and thanks Don. That's such a really good condensed summary on Sirhan's research and the deriving roles and the impediments behind inflammation resolution when we're omega deficient. So really, really helpful. And I really enjoyed listening to that. So ahi flower is playing a different role, and it's really complementary to everything that Dr. Don just shared. Ahi flower is the product that our company innovated. It's only been in the marketplace for about 5 years. It's a crop grown entirely in the UK. So this lead-in photo is a field of ahi flower in near Cambridge in the UK. And we call it the most complete and balanced plant-based full spectrum omega source. And this is why we call it that. First of all, ahi flower contains the most biologically advanced plant-based omega-369 content, notably the richest combined STA and GLA, which I'll share with you why that's significant on the next slide. We've already established in human clinical trials that ahi flower contributes to this whole thing that Don just talked about in terms of the omega-3 side, to EPA up to 4 times more efficiently than flaxseed oil. And flaxseed, as most of you probably know, is the dominant plant-based omega source in commerce. We also have evidence now that ahi flower fluxes readily to circulating DHA, which is also, that's the longest chain omega-3 fatty acid. We say ahi flower is an excellent 4-to-1 omega-3/6 ratio. So the ratios that Don has been talking about is 6:3. So flip that around for this lecture's purposes. Ahi flower's omega-6/3 ratio would be 1:4. So you can see how immediately that helps the body get closer to that sort of pre-industrial 1-to-1 level. But also ahi flower has exceptionally good essential ALA and linoleic fatty acid content, which of course fish oil contains none of. So its total omega-369 content is greater than 85%. That's the richest in the plant kingdom. Also from a patient compliance standpoint, it has an excellent taste and aroma. 2 published human clinical trials so far, and it's regeneratively grown, it's fully traceable, and it's non-GMO. So from the standpoint of managing this overall healthy inflammation response, helping the body get back to balance against excess pro-inflammatory omega-6 linoleic acid, which forms arachidonic acid, ahi flower is going to be your best choice. And we're very honored and pleased that Greens First selected ahi flower. They're one of the earliest adopters of ahi flower, going back probably at least 4, if not 5 years. So they've been out on the cutting edge of this, and I'm not surprised seeing the rest of this presentation. So just very quickly, the first human clinical trial that was carried out with ahi flower established that it was safe at very high intake levels. And it also showed this very important, much higher tissue accrual of EPA, omega-3 EPA, up to 4 times more efficiently than flax, but also significantly raised anti-inflammatory dihomogamma-linoleic acid, which I'll explain. Our second human clinical trial was a dose ranging trial that looked at, okay, so we know that it raises EPA, but we want to make sure that you're still seeing that signal even at more, typical intakes. And so we were down at around 2.5 grams, and we saw a linear response. So it's there, it's helpful for EPA accrual. But then we also were looking at other metabolites on the omega-3 side, and we saw significant increases in ETA, which I'll show you on the chart, and DPA. So you're getting a kind of a full spectrum response from the ahi flower in terms of all these different omega-3 fatty acids, which have documented pro-resolving status just the way that EPA and DHA do. And this is all coming from Sirhan's lab. So it's the same research teams that are establishing these metabolites. But it also showed that ahi flower increases a anti-inflammatory cytokine called IL-10, interleukin 10. This is part of the body's natural inflammation response mechanism, which Don described, which shows that you have to have these circulating omega-3 fatty acids in order to produce these anti-inflammatory hormonal cytokine responses. While ahi flower was the first plant-based omega to show exactly that one of those anti-inflammatory cytokines is actually being upregulated. And that was considered a novel finding. So when we're talking about this, the ratios and the balance and restoring balance, it's helpful to see this overall chart, because this shows the omega-3 family starting at ALA, going through SDA, onward to ETA, EPA, and DHA. And on the omega-6 side, linoleic acid, which is hugely dominant in the kind of modern Western industrial diet. It comes from corn oil, it comes from soy oil, palm oil, all of those kind of industrials are very, very high in linoleic acid. Well, that becomes a competitive factor, the result of which is the elevation of formation of arachidonic acid. Well, with ahi flour, which is the richest source of SDA and GLA, you can see it falls outside the liver's hepatic rate limiting step in terms of conversion. So when we're giving the body the omega-6 GLA, we're bypassing that step, and there's clinical evidence in humans that shows that it preferentially forms DGLA, and DGLA has its own body of anti-inflammatory response support, and it does so competitively against the formation of arachidonic acid. That is not going to be possible with just taking a marine omega-3 base. So this is why Greens First has made this part of this complementary protocol, is that this is how you're going to see faster and better balancing on the omega-6 side towards the formation of more efficiently formed anti-inflammatory metabolites, both on the omega-6 side and on the omega-3 side, through the supply of the stearidonic acid that ahi flower oil is the richest dietary source of. So we get a preferential pathway versus arachidonic acid formation from ahi flower, and ahi flower is going to be the richest and most efficient way to achieve that because of its uniquely high combination of omega-3 and omega-6 stearidonic and gamma-linolenic acids. It really ends out that, the omega-6 source form that you're taking in, it really matters. And we feel very pleased that ahi flower is part of that. I know I'm very limited on time, so I'm just going to show you a couple more slides. This is evidence that's just come out from research that we're doing at the University of Toronto. This just shows that when you compare ahi flower to flax to a pure DHA from a marine source, you're getting much higher elevation of plasma ETA, which sits between SDA and EPA, and which has its own emerging literature around its role in modulating the cytokine inflammatory response. Ahi flower is going to be the best and richest way of achieving upregulation of circulating ETA. And then ahi flower also plays a significant role, as noted, in raising plasma EPA. So that was borne out here, comparing ahi flower to flax to a pure DHA source. And you're not going to see retroconversion benefits there from just taking a DHA source. That's why the Greens First EPA DHA combination is so important. Ahi flower, looking at ahi flower versus other kind of leading omega sources on the plant side, ahi flower is going to show it has the richest overall omega content. So it's a full spectrum source. Now, again, omega-3/6 ratio, Don talks omega-6/3. So ahi flower would be 1:4, which is going to help every patient achieve that more optimal status of a omega-6/3 ratio closer to 1:1 or 2:1, like that 62-year-old patient. Ahi flower is going to be the only way to significantly boost that DGLA over arachidonic acid versus any other plant-based source, but certainly also versus fish, because fish oil is not a omega-6 source at all. And I have one. Okay, I have one more slide, but it may not allow me to go forward. No, I'm not able to advance. So I think I'll just stop sharing then. My last slide was basically to reinforce how important it is for all of you practitioners to participate in the End-Flame protocol, because it's the only way that you're going to be able to assess both for yourself and then ultimately for your patients where you sit on the spectrum of the omega-3 index and the omega-3/6 ratio. So now I will stop sharing and hand it over to Dr. Don.
Okay, let's see here. All right, see if I can advance now. Yes, okay, well, thank you so much, Greg. And everybody listening, we only have a couple of slides left and we'll wrap this up. But now you can see how we can go so confidently in implementing Sirhan's work, using that term full spectrum. Most of us, if we use any type of omegas, we typically stay focused only on the omega-3. That's very important, but so are the polyphenols. And now you understand the essential omega-6s. Essential, not the arachidonic acid. We get plenty of that from our diets, too much of that. That's what causes the imbalance. But we're delighted to have, and I think the absolute best, and you know why now, package. And you're going to be very unique in your community because you're going to be like anybody else that has this opportunity. So in wrapping this up, here's what I would like you to consider doing. I want you to try this on 10 patients. Now, I know what most doctors will tell me is like, hey, doc, I never recommend anything to a patient that I don't try it myself first. And I've said that myself, you know, if it's a brace or a pillow or a support or whatnot, I get it. But the point I want you to realize is you do need to test yourself. You'll be surprised. I've done close to 300 of these consults. Every one of them are enlightening to the practitioner. Do get that free test from Spencer and test yourself, and let's talk. But I want you at the same time not to hold back from your patients. Try this on 10 patients simultaneously. I mean, it's new to you today, but it's been out since 2000. That's 21 years old. Since 17, Sirhan has given us a roadmap to follow. So I want you to realize, why wait 4 months to start helping patients? It'll make significant if you do. And when you end up helping them, if you do this blood test on anyone and everyone that has musculoskeletal pain, the results alone will help make you make better clinical decisions. And you also know that all patients want to get out of pain as soon as they can. I mean, that happened to me for my entire 20 years in practice. So down in that left-hand corner you see on the screen, that's a 5-panel brochure, an End-Flame brochure. You can get that from Spencer at Meyer DC as well. And it really does the selling for you. It will convince a patient, show a patient how they could possibly get out of pain sooner if they do have an essential fatty acid imbalance, and why you're suggesting the blood test. So get that brochure, look it over, and use that as you can. Now, when you start 10 patients on this, monetarily, it can make you an extra 10 or 12,000 a month on each 10 patients. I mean, how? Well, come on. Whenever you buy something wholesale and sell at retail, your profit is built right in. You buy the test for 40, most doctors sell it for 80 to 100. Right there's 100%, 120% markup. Patients stay on the supplements for 4 months, not because you want them to. The research is very clear. They're going to go up significantly, improve in the first 4 weeks, but in 12 weeks, they hit a new baseline. That's going to generate you another $1,000 to $1,200. So, hey, 10 patients each month could make you an extra 10 to 12,000 or more. What if you put 20 on? What if you put 30 on? What if you put them all on? And that's really what's best. But the biggest amount of profit you're going to make, you know as well as I do, is from referrals. When patients get out of pain quicker, and you can see that first 4 weeks are going to be significant, they're going to tell people about that. When they show them their pre and post blood tests that they're impressed with, they're going to tell people, and you're going to generate referrals. So in closing, Sirhan's research suggests that it's time for healthcare providers, it's time right now to bring their musculoskeletal practices into the 21st century. And he says to do that, You're going to have to challenge current inflammation treatment protocols. In this case, all of you listening, it's your own. You got to challenge it. There's been a lot of people before you. The orthopedic surgeons in every community are doing this. That'll let you know it's everybody, because $1 billion a year on one omega-3 prescription drug tells you it's pretty popular. And there's avenues that you need to advance it. So Inflame is a new avenue with better therapeutic potential. So to get started, all you need to do is buy what I'll call is 10 Inflame starter kits. You see at the top right-hand corner there, that is a kit, a starter kit, if you will, 4 items up there. So buy 10 of those, and Meyer DC will give you 2 of those complete sets of 4 free. So just call Meyer at 800-472-4221. Spencer's extension is 5057 to get your own free test for yourself and or to take advantage of this special. And as you see, we didn't have time for a Q&A. I love those, but my email is down below, drdonhaysdc@greensfirst.com, Dr. Don Hayes, dc@greensfirst.com. Also, my cell is there. You can call me or text me with any question you have. When you do place an order, you'll get, as you see in the bottom right there, you'll get your own copy of the Inflame dosage chart. So on behalf of Greg Comerford, which did a wonderful presentation, we hope to have him back with a little bit more time on that he can utilize to tell us the research. On behalf of him, I want to thank him for being here, Greg for being with us and doing such a good job. I want to thank my team at Greens First. They're incredible. My team at Meyer is also incredible. And more importantly, I want to thank each and every one of you. And being in practice 20 years, I know how hard it is to take this much time away from your practice, but we appreciate you do. If you have questions of me, don't hesitate to contact me. But please take advantage of the special, get a hold of Spencer at Meyer, and we will go from there.